coming and spending time with me today. I know we're going to talk about health coaching, and it feels like it's a new industry, but I know it's been around for a couple of decades.
Yep.
There's still a lot of confusion about, well, what health coaching is. So can you start off with maybe explaining what health coaching actually is, and maybe give us like a patient example about how it impacts people's lives?
Sure. I think the best example to start with is with my own, and which is actually how we got into how this company started in the first place. So I was a cancer patient 7 years ago, and after everything was said and done after the doctors gave me my life back, my health back, I still felt very broken. And that's why I actually discovered health coaching, because health coaching took care of parts of my mind and my body that medicine didn't. So it helped me do the things that I needed to do. For example, nutrition, nobody was taking care of that. The psychologists want to talk about cancer, which I didn't. I wanted to get back into sports, which was not recommended. I wanted to deal with my anxiety, which there were no tools for. So that's really what health coaching is. It helps an individual work on the issues that they have, and not what the society tells them that they should be feeling as a patient.
And my quick summary of after taking a 9-week class, it was a non-clinical psychotherapy. Really, just that's the two kind of key words that also describe it.
A health coach is a behavior change agent. They help people reach their health and wellness goals, and those are really, really wide. There's a wide array.
So the formation of your company then came about from your personal experience of not being able to find a solution like this?
Yeah.
Is that accurate?
Yeah, I did not have anybody that I could turn to. Even though health coaching, like you just said, has been around for 20 years, it's still pretty nascent. And we were living overseas at the time, and that was just not existent at all. So kind of created my own solution. I became a health coach, and YourCoach Health actually started as my business for me to work with my clients as a platform. And it evolved into what it is today, which is the operating system for behavioral change powered by health and wellness coaches.
So you became a health coach. Eugene, you talked about having gone through a 9-week course to understand it better, and I don't know if you are a health coach now or no.
No,
but you've gone
and
through
I won't even pretend.
Yeah,
but
it's like driving through Harvard.
Yeah,
You said I've been through Harvard. You just drove through it. Exactly. But there's a lot of confusion around what a health coach is, and I think some people use the term just flippantly, and there actually is a lot of regulation and standards around the practice. So can you give us a little bit of an idea about how it's regulated, how it's certified, what the regulations are for people who want to purport themselves as health coaches?
Yeah, so there's over 100 health coaching schools just in US alone, and there's a National Board for Health and Wellness Coaches, which does do the overall big certifications. However, a certification alone does not make somebody a great health coach. So this is something that we do on the platform. We actually use real world data. We see what these coaches do in the wild, and we can understand who they're really great at working with, and if they do follow the coaching protocols, the scope of practice.
Yeah, and in addition, I think when we got started in January of 2020, actually a few months before in 2019, the national board that Marina alluded to before with the American Medical Association released CPT level 3 codes, so they were out for testing. And just about a month ago, or very recently, the same national board with the UC San Diego just opened this up for real-world data collection. So we are looking probably 24 to 36 months for reimbursement for health coaching specifically.
Excellent.
It's a very exciting time for the industry.
So you were talking about your experience going through and becoming a survivor of breast cancer. You were talking about your experience going through some training. You were also by Marina's side as she was going through that in the role of a caregiver and trying to maintain the household and the parenting responsibilities. So I think a lot of people might look at health coaching, which is something that you wanted, as a bit of a navigator to help people get through that health journey. Is that a fair assessment to use that term of a health navigator, or is it a completely different solution?
So we get that a lot, and I know that's your favorite topic, so I'll let you take this one.
So I think navigation. There's lots of companies in healthcare to navigate this crazy system, right? At the end of the day, a health coach, and from a kind of even definitional perspective, is somebody who helps you understand, set, and achieve your goals, right? And navigators, I think, inside the healthcare system today are looking at, where to triage you and refer you and et cetera. So a health coach is much, much, much more than that, right? And ultimately, my earlier description as a non-clinical psychotherapist is somebody who is upstream helping you, again, even understand your goals. Sometimes people don't understand them, right? So we don't like calling it navigators at all because it's much, much more than that.
But there are so many tools out there, and health coaches do know these tools, and they can't recommend them, but it is more than a navigator.
Well, I think the pandemic has certainly raised a lot of visibility of some of the shortcomings of the healthcare systems and of the access to the healthcare system. So has that been a benefit for your part of the healthcare environment, to have more people appreciate the role that health coaches can have in keeping them well and out of hospital, and not focusing on pills, but really focus on nutrition and exercise and other aspects of mental health?
For us, it's been a little bit of an unfair advantage. I mean, that's probably what you were going to say also. More people are realizing the benefits of preventative health, and they're coming to us. I mean, we see the requests of individuals who are coming to us looking for health coaches, and people are desperate and they want help, and they're willing to just trust anyone. And that's why, as health coaches, we have great responsibility to take care of these people and to nurture them and to make sure that they're going in the right direction, because, I mean, COVID did a number on everyone.
And the countless inbound into us from digital health companies, digital therapeutic companies, clinical trials, patient support programs. Health coaching seems to be the buzzword. And so I think, part of that is for ourselves to kind of refine the product and the product roadmap. And I guess I'll let you do your favorite component of that, what the product definition of us.
The operating system.
That's right.
Okay, we started with this. I guess we're going to end with this. Yeah, we're the operating system for behavioral change powered by health coaches. And this is the gig economy of health coaches that are on our platform. We nurture them first and foremost. We started as a health coach, a platform for health and wellness coaches, and that's what we still are. And we nurture this community, and we give them opportunities to help even more people through our partners.
You're helping them scale to improve the lives of countless people and actually future generations.
We are. I mean, our mission has always been for the 8.5 billion projected population by 2030 to have access to health coaching, and it's still our mission.
Brilliant. Well, listen, thanks so much for coming by and sharing your story and sharing your experience, and for having the impact that you are on people's lives. Wish you a lot of success in the year and years ahead.
Thank you.
For being
Lovely
here.
as always.